Welcome, everyone. We'll be hearing from the Honorable Adrian Dix, Health. We are also joined today by provincial and territorial health ministers from across Canada. Following remarks from Minister Dix, we will open the floor to media for questions and answers. All ministers present here today are available to respond to your questions. Time is limited today, so please be specific about which minister you're directing your question to. We will begin with questions in the room and then move to questions online. With that, over.
Thank you very much, and good afternoon, everyone. Today we gather on the territories of the Musqueam, of the Squamish, of the Tsleil-Waututh First Nations. We're honored to be here on their lands. I'd like to, of course, welcome my fellow ministers of health to British Columbia. Welcome also to media joining us from around Canada. I know it's not around the world on shortwave anymore, but it's on Canada via Zoom, and we really appreciate that. These meetings are important. The last time we were seeing the transformation that sometimes happens. We last had a meeting of ministers of health in person in 2018. The only person who's still Minister of Health, as it turns out, is me, and I'm chairing the meetings today. But what we have done over a number of years, this group of people, which have worked together virtually, usually, and with our partners, including the federal government, to address issues around the public health emergency facing our provinces, our country, and our world. And I am impressed always by the willingness of my fellow ministers of health to work together. We got a chance to talk about all the good work that's happening, all the hard work that's happening, in a goal of making public health systems better for people across the country. We had productive discussions, which talked on many aspects of our public healthcare system. Provincial and territorial ministers have each identified their priorities within their jurisdictions. And we're certainly going to be taking that message, which is really a common message, in our discussions with the federal minister tomorrow. Our goal is to better meet the health care needs of people in our communities. It's our duty as Minister of Health. And I think that that reflects what we've done throughout today. I want to, aujourd'hui, les ministres de la Santé ont discuté de leurs priorités, y compris leurs plans provinciaux et territoriaux respectifs, pour remédier au manque de ressources humaines dans nos systèmes de santé, les innovations en matière de santé numérique et le partage de pratiques dans les services de santé mentale et des dépendances. Je peux donner des exemples de ce qu'on a parlé. Le Québec, par exemple, a investi 400 millions de dollars pour recruter et former 600 nouveaux médecins et 5 000 professionnels de la santé additionnels, afin d'assurer que les professionnels de la santé puissent mieux utiliser leur champ d'exercice complète. Ontario is expanding the scope of practice of many healthcare workers, including pharmacists, to better support patient care. Nova Scotia is supporting international healthcare workers' settlement into rural communities through the NICHE program, the Nova Scotia's International Community of Healthcare Workers Engagement Program. New Brunswick increased their medical seats. PEI has dedicated medical seats set for their residents, including Indigenous students. Manitoba has done significant work to reduce the backlog of surgical waits resulting from canceled surgeries throughout the COVID-19 pandemic. Alberta has reduced wait times for cataract surgeries in a significant way. Saskatchewan has made significant international recruitment efforts and accelerated licensure of nurses and healthcare workers. The territories, all territories, are addressing the unique circumstances of small communities in maintaining a workforce and relying on some southern provinces for many healthcare services. In BC, of course, and all of you who are from BC know that, we've added 38,000 healthcare workers since I've been Minister of Health net. But we know, and that's why we have a health human resource plan with 70 actions, that we need to add another 38,000 in the next 5 years and another 38,000 net in the years after that. And that requires a constant effort to retain, recruit, attract, train, and make system improvements to our healthcare system, including expanding the scope of health professions. This has been the core of our actions. There is not a jurisdiction in Canada that is not pursuing a health human resources plan that is significant and necessary for the extraordinary challenges of the present and of the future. And we were, I think, today received significant evidence of both success and the challenge and the opportunities facing us. And I think all provinces are committed to taking those actions, extraordinary steps that we've taken together over the last two and a half years during the COVID-19 pandemic and into the future. We know, and you know, there are significant challenges facing the healthcare system right now, that this is going to be a difficult winter because we're going to see, and we've seen this in the Southern Hemisphere already, significant increases and challenges related to respiratory illnesses, including, but not limited to, COVID-19. And that means we're taking, all of us, short-term measures to prepare for that and necessary short-term actions. And we need to build out for future expectations of the healthcare system. Public healthcare has demonstrated its value to every Canadian in the pandemic, and we have to take that support for public healthcare and respond to the challenges and difficulties facing the system today by our healthcare workers and by our patients. And this group of provincial health ministers and the health systems across the country are determined to do just that. Of course, at the core of that, everybody pulling their weight in their jurisdictions, the extraordinary effort we've seen, are seeing, and will see at the provincial level, we need support from our federal partners. And today we reiterated our call on Canada's Canada's premiers, led by Premier Horgan over much of the last year, and now by Premier Stephenson, for a renewed healthcare funding partnership with the federal government delivered through the Canada Health Transfer. The degree of unanimity and support for this over a period of months, as we have waited for any federal response, has been a source of strength, demonstrates the willingness to focus on what matters to people, which is the quality of care and the delivery of services, is demonstrated again today by our united and common approach to see a change in the Canada Health Transfer and an increase in the Canada Health Transfer such that we can meet the demands of the future. The united position of Canada's premiers seeks to increase the federal government's share of provincial and territorial health costs to 35% and to maintain it at this level going forward. The Canada Health Transfer is the most efficient mechanism for federal funding support because it ensures that provinces and territories have the means to address their diverse system needs and priorities to deliver the tests, procedures, and health services Canadians across the country need when they need them. And so we are looking forward, of course, to meeting with the federal health minister, Minister Duclos, tomorrow. We've heard, as all of you will have, a willingness by the federal government to increase its share of the Canada Health Transfer. And of course, the federal government saying that they are prepared to invest more is good news. And we look forward to seeing details. We hope that such an announcement and any discussions we have tomorrow lead to what we have been wanting and expecting for months, really since one was promised and announced in 2015 in the incoming government's election platform. A First Ministers meeting on the Canada Health Transfer, where we talk about the future of healthcare in Canada and raising that health transfer to meet those needs. So I am, of course, on behalf of ministers, pleased at the news that there may be more money, and anxious and happy to look forward to our discussions with Minister Duclos tomorrow, and hopefully a future federal provincial territorial conference on the Canada Health Transfer, which will come from there. This is an important time for public health care in our country. And I think the work that the ministers of health have done together on the key issues facing healthcare today and will continue to do tomorrow, our unanimity of message, our unanimity of action is what Canadians need. It is going to be and is a difficult time. And we need to respond to that, not by having unnecessary disputes, but doing what we've been doing, which is straightforwardly over a period of months and unanimously, regardless of territory or province or political affiliation, laying out a case for the future. That is what we continue to do with respect to the Canada Health Transfer. And that is what we're going to continue to do in the days and weeks to follow. And I am delighted when you ask for a meeting, when you ask for discussions, when you ask for engagement, that anyone would take part with a positive answer. So we're pleased and awaiting, obviously, more details from what Minister Duclos announced today. But our position hasn't changed. The Canada Health Transfer is the best way for the federal government to support public health care in Canada. And surely after what we've all been through, this is the moment for us to come together and fundamentally change that in the future so that we can ensure that those services are there today and in the months and years and decades to come. We're happy to take your questions.
Minister, we will now take questions in the room. Nous allons maintenant prendre des questions des journalistes dans la salle. If you wish to ask a question, please do so from the floor mic, which is to Minister's right at the back here. You will have an opportunity to ask one question and one follow-up. When you start to ask your question, please state your name, your media outlet, and to whom your question is directed. Veuillez indiquer votre nom, votre média et le destinataire de votre question. Vous aurez la possibilité de poser une question avec un suivi. Let's proceed to the first question.
Hi, it's Camille Baines with the Canadian Press.
Hi, Camille.
Hello.
I can barely see you through there, but
provinces and territories have balked at conditions in the past for money that would be coming through the health transfer. Are you willing to have some conditions now for more money? Because with the bilateral agreements, there have been certain indicators and certain health areas that were covered by them. What are you not willing to do to get more money?
well, what we want to see is a national meeting. And unlike at times, and we've never heard this really directly from the federal government, we're prepared to have that meeting without preconditions, right? So we're prepared to have a national meeting. But let's be clear. I mean, what we've seen is the decline in the Canada Health Transfer over time, such that it has put, I think, serious burden on the delivery of services to people. So we're absolutely prepared. I am hopeful, and obviously we'll be hearing more from Minister Duclos in the next period. I'm hopeful that their willingness to step up and have a discussion about the Canada Health Transfer will lead to a First Minister's Conference with what we need and a positive outcome for healthcare in Canada. So, you know, I haven't, and I've always said, and I always believe, and Premier Horgan has always said, and all the premiers have always said, that we expect, after years and years and years, and now a full year of calling for this, that the federal government will agree to such a meeting, and we'll look forward to having those discussions. But it's, is it bad news that they're offering, they seem to be proposing more money? No, it's good news. And we look forward to the discussions.
Follow up, Camille.
Are there certain priority areas that you would all agree on for more money? And would you agree to timelines for results that the Prime Minister has called for today?
Well, look, we're doing it already. Just tell you what we've done in the last 2 months. A new health human resources in British Columbia, a new health human resources plan that has 70 actions. We've seen evidence of it already. Improved security for nurses, a new agreement that reforms primary care with doctors, 602 new nursing spaces, the largest increase ever in the medical program at the University of British Columbia, a new SFU medical school, and it goes, and the list goes on and on and on. So we're taking the actions necessary. And if you look at every other jurisdiction, I mentioned all of them in my statement. If you look at ce qu'on fait actuellement dans la province du Québec, où on investit dans les priorités de l'avenir du système de santé, alors qu'on fait face à des difficultés actuelles de la pandémie, or in any other jurisdiction, that's exactly what we're doing. We're delivering action now. The action is happening now. The priorities are being expressed now on health human resources, on a focus on primary care, on, as we have in BC with surgical renewal, reducing surgical wait lists, on addressing the increased complexity of care that has resulted from the pandemic. And of course, every province currently, right now, as we speak, is delivering yet another major immunization program that deals with both COVID-19 and influenza. So we're acting. And those actions demonstrate our priorities. It's not, and I think what we need and what we're hopeful about is there'll be action at the federal level as well. That's what I've been calling for, and in particular, Premier Horgan has been calling for all of the last 12 months, all of his time as head of the Council of Federation. That job has been taken up on behalf of Canada's premiers by Premier Stephenson. She's doing the same thing, and I think that that continues to be our effort. But we want to talk about action on healthcare. It is unprecedented, the degree of action in systems which have already faced 2 years of some of the most profound pressure. Someone asked me if healthcare was in crisis in BC. We've been in BC and in Canada. We've been in crisis since the COVID-19 pandemic was announced formally in March of 2020 and hit us really in February of 2020. And we're going to continue to respond. So our priorities are not demonstrated through words. They're demonstrated through action, and they're going to continue to be.
Prochaine question. Prochaine question.
Bonjour.
Bonjour, Christian Noël de Radio-Canada.
Bonjour, Christian.
Bonjour. Ma question est pour notre autre, M. Dix,
Ouais.
M. Dubé du Québec et tout autre ministre qui voudrait bien répondre en français, s'il vous plaît.
Ouais.
Le M. Duclos, le ministre fédéral de la Santé, semble venir d'avoir fait une nouvelle offre il y a à peine une demi-heure avant votre conférence de presse.
Ouais.
Est-ce que vous êtes encouragé ou déçu par cette offre?
Bien entendu, encouragé. Bien entendu. Parce que nous n'avons pas eu quelques réactions que ce soit depuis un an, franchement. Le Premier ministre Horgan a présenté ce message à maintes reprises au Premier ministre Trudeau depuis un an. Donc, d'avoir quelque chose, peut-être, j'espère, de concret de la part du ministre Duclos et du Premier ministre Trudeau, c'est de bonnes nouvelles. Mais il va falloir en discuter, bien entendu, et j'espère à un forum, à une conférence entre les premiers ministres du Canada, des provinces et des premiers ministres des territoires au Canada. Je pense que ça, c'est absolument nécessaire parce que ceci est une opportunité historique pour nos systèmes de santé et chaque pas qui est positif me paraît quelque chose qu'il faut quand même suivre. Donc, on va le faire, bien entendu. On a exigé cela depuis un an et on va continuer à présenter la nécessité du gouvernement fédéral de prendre ses responsabilités en matière de financement des systèmes de santé. Nous avons dans chaque province nos propres politiques qui, je pense, qui ont beaucoup d'éléments communs, on a vu cela aujourd'hui, mais qui répondent aux nécessités réelles de la population. Et ce n'est pas une question de mots, de paroles, mais d'action. Et on va continuer d'agir, mais il va falloir que le gouvernement fédéral prenne ses responsabilités. À ma part, je suis très content que le ministre Duclos a démontré une volonté aujourd'hui. Et maintenant, il faut passer aux discussions sérieuses.
Suivi.
Avant, pour la première question, M. Dubé. Merci.
Merci, Mr. Bix. Tout à fait. Ma première réponse serait de vous dire clairement que oui, c'est une bonne nouvelle parce qu'au moins, on commence sur le bon pied en disant qu'il va y avoir plus d'argent, ce qui n'était même pas sur la table il y a quelques jours. Alors ça, c'est la première bonne nouvelle. Pour le cas du Québec, parce que je vais parler pour mes collègues au Québec, c'est sûr qu'on a toujours été très clair que tout transfert fédéral devait être sans condition. Dans le même message aujourd'hui, M. Duclos a parlé de conditions, ce qui fait pour nous que ça, c'est pas acceptable. Puis c'est pas un nouveau message, c'est pas une... Alors, et je donnerai l'exemple, lorsqu'on parle d'indicateurs de performance, je vais vous dire, le Québec, il est redevable envers les citoyens du Québec puis l'Assemblée nationale. Il n'est pas redevable envers le fédéral parce que c'est de compétence provinciale. Et moi, ce que je dis, c'est une très bonne nouvelle qu'il y a des fonds supplémentaires, mais il faut que ça soit sans condition. Et on va continuer à travailler pour améliorer notre réseau comme tous les ministres de la Santé sont ici. Et mon dernier point, si le gouvernement fédéral veut des statistiques, on a un tableau de bord qui est public, qui est disponible pour eux. Merci beaucoup.
commencerai avec vous, M. Dubé, pour ensuite peut-être poser la question à M. Dix, juste pour faire changement. Justement, l'idée que le ministre Duclos parle d'avoir un deuxième volet de financement qui serait fait sur mesure pour chacune des provinces. Est-ce que ça, c'est bienvenu parce que ça respecte les responsabilités des provinces, ou est-ce que vous voyez ça comme étant une façon de diviser pour mieux régner?
Ben, écoutez, je pense que je ne veux pas parler pour les autres provinces parce que c'est déjà assez complexe cet enjeu-là. Je vais parler pour nous. Pour nous, c'est une compétence provinciale, puis on va continuer de faire les mêmes demandes. Merci.
M. Dix, est-ce que c'est une bonne chose ou un cadeau empoisonné d'avoir un deuxième volet?
Ce n'est pas possible que ce soit un cadeau empoisonné, c'est de la part du gouvernement fédéral. Donc, ça va de soi, c'est une contribution au débat. Et nous sommes prêts à faire le travail, n'est-ce pas, ensemble. Et on va continuer à être prêts à faire le travail ensemble. En ce qui concerne l'argent, c'est un pas peut-être important et j'en suis très content. Mais il va falloir travailler ensemble. Donc, il a annoncé quelque chose il y a quelques minutes. C'est de bonnes nouvelles en général, mais il va falloir travailler les détails, bien entendu.
Next question.
Hi, I'm Mr. Mike Crowley from CBC News.
Hi, Mike.
Both the Prime Minister and Minister Duclos talked about results. What would be some actual results for people in the healthcare system that you would actually like to see? What kind of things could you achieve? What sort of improvements would you like to make that you would actually see some common ground with the feds? Are we talking more people covered by family doctors? Or, you're talking about more internationally trained healthcare workers in the system? What kind of actual changes?
Well, I can, in this respect, I can speak on behalf of the other ministers of health. We're all about delivering results. And you see that in the measures I've talked about on the health human resources side, the extraordinary efforts in every province, whether it's new nursing positions in PEI or in British Columbia, whether it's new allied health positions in Ontario or in Quebec, whether it's all of the actions we're taking together on family doctors. We have delivered more information and more transparency on results than has ever been delivered before. One of the outcomes of the COVID-19 pandemic were daily updates on healthcare for a time, on the results of our immunization campaigns, on the results of our surgical renewal efforts, after many provinces had to delay non-urgent scheduled surgeries in the pandemic. And so you see the results constantly. As Minister Dubé has said, we deliver those statistics every day, all the time, right? If you look at long-term care, for example, you see across jurisdictions an increase in the number of direct staffing hours for residents in long-term care. In BC, before I became Minister of Health, only 12% of care homes met our own standards. Now that's 100%. Those are outcomes, those are statistics, and they're all publicly available. So from our point of view, we need to deliver health human resources that address issues now and in the future. There are going to be many more Canadians. In BC, twice as many people over 75 in the next 10 years. We have the highest rate of growth, but all jurisdictions have significant growth for that. We have to deliver better seniors care. By definition, more of that needs to be in home care and home support. We need to improve and address, for example, age-related cancer, where we're expecting to see a similar increase across jurisdictions, and we'll have to respond to that. And in primary care and in other key areas of healthcare, we are working to deliver results. That is the purpose of all of the health human resources plan we put forward, and the measures especially on surgical and diagnostic care that all provinces have put forward. So in terms of outcomes, the outcomes are going to be clear, and it's because, as Minister Dubé has said, we intend to deliver that information and the expectations, whether the news is challenging or not challenging, to citizens of our province. And that includes, in the case of Minister Dubé, Minister Duclos, and that includes everyone else. So what you're seeing and what we need to show is across the board more transparency on these actions. We've done that during the pandemic. We have to continue to show that, and it will be evident from everywhere the impact of our actions.
And then second question, just to shake things up a bit, if maybe Minister Jones from Ontario could answer this.
Sure.
Minister Duclos talked about tailor-made agreements with provinces and territories that would focus on what your individual priorities are. What would be some things from Ontario's perspective that you would like to see specifically made a priority?
Well, I think when we get the flexibility and the increase of the current Canada Health transfer from 22% up to 35%, then you actually start seeing the investments that the provinces and territories have already made, we've already highlighted. Those are multi-year, ongoing commitments that we as provincial and territorial governments have made. And I think it's really incumbent on the federal government to step up and say, we will make that commitment because we understand and appreciate that when provinces and territories train additional health human resources, those are costs to our communities and to our governments that are ongoing. The federal government, by ensuring that they are part of that commitment to make sure that we have sufficient health human resources in our communities, is really why we're all here. It's really important for us to be able to individually, and we've already done it, make changes that are putting investments into our hospitals, into our primary care, into our colleges and universities. But we also need the federal government to say, we see the commitments you're making, now we want to assist in the ongoing costs. Thank you.
Lindsay Duncombe, CBC National News. Question for Minister Dix. Can you give me kind of the best case scenario timeline here? We're talking about this meeting today, then looking forward to a meeting with the premiers and the Prime Minister. If everything goes the way you want it to, how quickly will there be cash flowing to improve all these situations that are unfolding across Canada?
Look, just to be clear, I'd go to a meeting on noon on Boxing Day to see that we start to address these problems. So I would say as soon as possible. I think realistically, knowing the budget structure of the federal government, realistically, and what they're doing, I would suggest that we would be hopeful in the fiscal year starting 23-24 to start to see that. In our experience with such offers, they tend to be over a period of time and with a cumulative number and a growing number over time. We'll see what they're offering. Our position is pretty clear that it needs to be back up to 35%. That's the position of the premiers that they've consistently held. And that allows us both the flexibility, I think, but also the means to pursue the massive efforts that are going on now and will have to go on for years to come. So I'm hopeful that we can move forward quickly, and and health ministers and premiers have been wanting this for months and months and months and months, in fact, more than 12 months, and arguably since the commitment was first made by the current federal government in 2015. So like I say, I'd be a little shy on Christmas Eve or Christmas Day, but Boxing Day, we're ready to go.
Does that match in your mind the urgency of the situation? We saw kids waiting for 9 hours at BC Children's.
I don't think anything can match the urgency of the moment, right? We've gone through 2.5 years of pandemic. In British Columbia, we have a public health emergency, that's the overdose public health emergency, that has affected our people in our province profoundly. And so we are acting with urgency. And you see that in the actions that we've taken virtually every day for 2.5 years, but especially in the last 8 months as we've transitioned to this new period. And just to put it in context, I mean, we're facing this fall challenges with respect to respiratory illness that are going to test, and people in BC know this because we presented in details what our expectations were and what we were preparing for in September this winter, something that every jurisdiction in Canada is doing. So there is absolute urgency now, and you can see it by the dramatic actions that we've repeatedly taken. And there's urgency also in the medium term to meet the growing demands on our system, because this isn't going to change anytime soon. And I think that Canadians have seen the value of public health care in the pandemic, and they will be strongly supportive of the federal government making the right decision and increasing the Canada Health Transfer, which will assist us in addressing these problems now and into the future. Urgency, you bet. Anytime, anywhere, we'd be prepared to move forward on this because this is of central importance and we're dealing with this right now. But we haven't waited for the federal government to act. Every provincial jurisdiction, every single one, has taken extraordinary steps over the last 2 years and even over the last 3 months to improve outcomes in the public healthcare system and respond to the real challenges we're facing on the ground. So we feel the urgency every day. And hopefully, the statements today are a serious engagement, I have no reason to believe they're not, by the federal government to assist in that effort, that our common effort to have a public healthcare system that responds to the needs of Canadians.
Next question.
Richard Zussman, Global BC.
Bonjour, Richard.
Bonjour. Human resources is clearly the #1 issue here. If you get the money from Ottawa, all of a sudden every province will have a little bit more money to play with and could decide to pay healthcare workers varying amounts of money. Was there any conversation around the table about an agreement that provinces would not poach healthcare workers from other provinces, or a conversation around a standard level of pay so that a doctor or a nurse from British Columbia may not be lured to Alberta or vice versa?
I think that's consistently been our position. And I think the issues as between provinces are sometimes issues around scope of practice and ensuring that people can move from one province to the other easily. It's our common issue, the issue of health human resources, and we have a common response. Every single jurisdiction is increasing post-secondary spaces. Our territories, who often depend for health professionals, because although there's significant training going on there as well, are very much in and supportive of that system as well. So the intention when we, for example, last week signed a collective agreement, a new master agreement with doctors, and changed our primary care system, is to address fundamental issues in our system here. But it has been inspired by actions taken elsewhere. And I think one of the strengths of public health care in Canada is that we can look to Quebec and we can look to Ontario and we can look to Alberta, for example, on scope of practice of pharmacists and make decisions and improvements such as that. So we are working together as one. That's a commitment we have together as health ministers to support one another in addressing the health human resources issues of the future. And obviously, this is provincial jurisdiction, and we negotiate collectively with workers across our jurisdictions. But we are very committed to supporting one another in both recruiting more members, more workers, bringing more people in who are improving pathways for internationally educated workers, which is also critical. But ultimately, for Canada, the key part of that is training more people here and having workplaces where we retain workers better. And today, we shared best practices and are supporting one another in that effort. So we're going to continue to do that. And it's an absolute priority of our system that we not engage in competition with one another. This is a collective effort, and we're working together within our jurisdictions and when we collaborate together to see that that happens. And you're seeing that at a national level now and at other levels in breaking down some of those barriers that sometimes stop people from fully utilizing their scope of practice in our provinces.
I know your math skills are better than mine, but based on going from 22% to 35%, that could be upwards of something like $43 billion the federal government would be transferring to the provinces. Do you think that's something a level of government can stomach, and that Canadians could stomach that amount of money now coming out of the federal coffers towards provinces?
I think that public health care is a fundamental value of our country, that the intention when the original federal-provincial relationships around public health care put forward was a joint financing on funding. And we've gone away from that to the detriment of healthcare systems. The reality in Canada, and it's a historic reality, and it dates to the original BNA Act, is that the federal government has significantly more taxing powers than the provinces, and it has evolved that provincial governments arguably have more jurisdiction. Certainly they have the jurisdiction in health and education that have become the modern priorities of governance everywhere in the world, right? So this is the reality of it. So we need the federal government to step up and play its role in full. And I want to be clear, if they do, I will be first, because I think sometimes people say, oh, well, they won't do it because they won't get credit, right? Like, believe me, if they deliver on the Canada Health Transfer in response to our requests, I will be giving them credit. We will be giving them credit. We're not that interested in credit. We're interested in delivering services for people, which means more nurses, more doctors, more health sciences professionals, more healthcare workers, better seniors care, and so on.
Thank you very much. My apologies to those reporters joining us from Zoom. Due to time constraints, we don't have time to go to questions on the line. We have one final question in the room. Please go ahead.
Thanks. Justine Hunter from the Globe and Mail.
Hi, Justine.
Hi. Is there some common ground on shared indicators on healthcare that you guys could agree to that would meet the demands of the federal minister here for data collection and measuring health outcomes?
Well, what I would say, Justine, is that there are unprecedented and public presentations of key data across provincial jurisdictions. Minister Dubé talked about the efforts in his province to do just that, as did Minister Jones today, as have all my ministerial colleagues. So there is more public information. You want information on surgeries, on wait times at children's hospitals, someone will refer to them. It's all public. And we are going to continue to build out public information available to everyone, whether they're ordinary citizens or federal ministers, so that they understand the value of what we're doing and its central importance. I think that is what constituents, what patients, what nurses, what doctors, what health sciences professionals, what healthcare workers want to see. And so we're going to continue to do that, continue to build out the information required to see how we're doing. It hasn't, we aren't doing sometimes daily briefings anymore, but we are responding on a daily basis, on a regular basis, with information on all the issues of public health care. And we believe, and we're open to providing that information to everybody in an increasing way. And that's, I think, will be of use to the federal government, but that will mostly be of use to Canadians and the Canadians we serve in all our provincial jurisdictions.
Can I open this up? Is there a minister here who would speak against having a national data collection? Like, that's the offer, there's cash on the table. If you guys are all willing to share this on a national basis, is there a minister here who says no?
Well, 2 points. One, we'll be delighted to see the offer when it comes. And I appreciate the discussion from Ottawa today. It's good news that there appears to be a change of heart on the part of the federal government in contributing to the Canada Health Transfer. That would always be good news. What I'm saying, and I think what provincial ministers are saying, is we have an obligation to provide the public with information about the healthcare system, and that includes indicators about how we're doing. And we're going to continue to do that. We're doing that more than ever, and we're happy to do and consider those options. But we'll wait, we'll be delighted to see the details of what Minister Duclos has to say when we see him at dinner in about 3 hours and 45 minutes.
Thank you very much, everyone. That concludes today's event.
Thank you.